Alright, what is going on, guys? Today we're going to be talking about the nose surgery that I had March 5th, okay? So for those of you who do not know what I'm talking about, I had a septoplasty done on my nose. It is not a nose job. Technically it is, but not what you're probably thinking. It's not for cosmetic reasons. I didn't physically change the structure or shape of my nose. I got this surgery done because of the fact that my airway processing through, the breathing of my nose was very fucked up. I literally could not breathe. When I would go to sleep, I would breathe through my mouth, snoring like a fucking pig. It was horrible for me. Now, I'm making this video because of the fact that this is going to be an update video from the video I previously made about this. It was about 2 to 3 weeks ago, and I was talking about it. I was about a week out from my surgery, and I still had some symptoms, some pain, some drainage, but besides that, it started recovering, a little bit better. And at the time I already had my splints out, and so shit was starting to recover really fast. Now I'm gonna be talking about a little bit what I talked about in my previous video, but if you guys want to see the full video, that video's up here, motherfuckers. So what are you doing? Why are you watching this one if you haven't seen the first one? Come on. Some people have actually wanted me to make an update video about this, and you know what? Fuck it, why not? Because this is an experience that I've had for the first time. Never probably gonna have this ever again, so I might as well display it on my channel for those of you who are thinking about getting this same surgery. I don't know, I'm just gonna display it, tell you guys my point of view. Was it worth it? Was it not? What did I do? The symptoms? Was it painful? Did I die? Am I fucking dead? And is this video not gonna come out? Like, what the fuck is going on? Now, the majority of human beings actually have a deviated septum, but there's a small majority who actually get affected by the deviated septum. I'm not too sure about the percentage rates. I'm pretty sure it's like 30 to 40, but don't quote me on that because I'm not too sure, like I said. But there is some people, such as me, who had a deviated septum to the point to where it was just fucking me over. Like, honestly, I could not breathe. When I go to the gym, I would have a hard time breathing. I would get dizzy, lightheaded when I would go to sleep. And also, sleeping is a very important thing. If you guys have this deviated septum problem, it's very important because when you go to sleep, you're not really recovering the best that you possibly could have if, you had the surgery. Like, honestly, I fucking started sleeping recently like, oh my god, like a god. Like, literally, I'm sleeping through my nose, not even like my mouth is open whatsoever. Like, I'm just relaxing. And actually, studies show that when you get this surgery, if you have this problem, this reoccurring issue of having trouble breathing through your nose, you actually recover much more better, and you're recovering properly because your body's doing what it could do and what it was having a hard time fucking doing because you're not breathing through your fucking nose. It all comes down to the same thing, ladies and gentlemen. If you have a deviated septum, is it worth getting the surgery? Okay, now I'm going to spit some facts right here, right now. Yes, yes, and yes. The reason why it is very important and why you should get this surgery is because it's not going to do any worse for you if you don't get it. Like, honestly, nothing negative is happening towards you getting this surgery whatsoever. If anything, positive incomes are going to be happening. You're going to be breathing better, feeling better, less fatigue throughout the day, much more healthier of a sleep. If you go to the gym, your fucking training progression is going to be much more significant. You're going to be able to properly breathe, fucking breathing in through the nose, breathing out through the mouth, all of that, right? Now, some people may judge me and be like, you look like somebody who takes fucking heroin and shoot up on a daily, because look at how small you are. Buddy, calm down, sweetheart. I know you might look a little bit bigger than me right now for the time being, but that's because of the fact that I haven't been able to work out for a month, and I actually just started working out a couple of days ago. It sucks because of the fact that when you get the surgery, yeah, clearly you can't train or do anything physically hard on your body because of the fact that you just got fucking surgery, one. Two, if you do anything that's physically intense on your body, you're risking a possibility of getting a nosebleed. Now, it's not just any normal nosebleed. This specific nosebleed that you could possibly get after the surgery is not really fun. So if you get this nosebleed, and you could get this regardless of even doing anything, you could just be laying in bed relaxing. This is a small risk, but now the problem is, guys, is you have to be careful because after getting this surgery, there is a possibility of getting this specific nosebleed. It's not like any ordinary nosebleed. This nosebleed in particular, if you get it, it doesn't fucking stop, and you actually have to go to the hospital, and then I guess they jam some fucking I don't even know. I don't know what it looks like, but it's just something that's, I don't know, maybe about this long and just fucking jam right in your nose. No anesthesia, no painkillers, no numbing cream, nothing. So I heard that that's very painful. Luckily, I didn't have to go through that. So yeah, guys, I mean, in order to really just push away the chances of you getting that whatsoever, just don't go through any physical activity for a couple of weeks. Don't push yourself. Don't strain anything, just relax. And even relaxing, there's still a small possibility, but it's very minuscule, so it's nothing to really stress about, right? Guys, this surgery has saved my fucking life. I actually just started working out a couple of days ago, and I feel all the benefits. I'm able to actually breathe, able to function, and you know, even before I was able to breathe and function when I trained, but I don't know how to explain it. It's like mostly on leg days. Legs in particular for me, I just feel like it's a huge overload on my body, and like I, you know, obviously need to require a lot of breathing, and it's just very difficult. And sometimes when you breathe through your mouth, yes, you're getting more airflow, but sometimes just that big amount of airflow constantly going through your body, like, you get my fucking point. That is not the best because, you know, getting that excessive amount of air and then breathing out that excessive amount of air at the same time is not the best, and, you know, you just fucking start getting dizzy. So I have a fat fucking nose, and I just experienced for the first time what's it like breathing through it. So, yeah, just don't blame me if I sound a little weird, okay? When I was young, obviously I was capable of breathing, but then when I started turning into 16 years old, around that age, I just started noticing there was some difficulty in breathing. And that's because of the fact that around 16 years old is when the nose fully develops. Now, the problem with that is, you know, if you're in cases like me, the nose develops in a way where you get fucked over. And again, you can't breathe. How many times do I have to fucking say it? So it's actually funny because there was actually this weird misconception, I guess you could say. And basically people thinking that I got the surgery and it was an excuse saying it was my breathing problems just to, you know, change the physical structure and feature of my nose. So I made some bullshit lie basically saying, oh, it's the airways, this and that. Guys, you really sound fucking redonkulous if you say shit like that, because the truth is a septoplasty is to specifically fix the problem that I had. And it does not change the cosmetic aspect of your nose, right? You're not cosmetically changing the feature or structure of the nose. How many fucking times do I have to say it? You guys confuse that to a rhinoplasty, which is to actually physically change the structure of your nose. Now, I actually could have gotten a rhinoplasty, and here's why. So here's the thing. The doctor was talking to me, and he was like, listen, I could fix your nose, and I could actually, you know, open up your septum and, you know, fix you up, right? So you could fucking be breathing a whole lot better. But the problem is the way your nose is shaped, you have a lot of tissue on the edge. And that tissue is a very big problem because of the fact that when I breathed in the past, it would close up on me. Like, imagine fucking breathing through your nose, and it would literally just collapse. Literally, like the hole right here would just go in and just collapse. Like, what the fuck, dude? That's not cool. It still does that to a small percentage, but nothing compared to before. I could promise you that. So he said that he could do a couple of things, right, that wouldn't change the physical features of my nose, but if I wanted to get that whole issue resorted completely 100%, then that's when I would start delving into getting a rhinoplasty. Now, I'm not getting a rhinoplasty because I'm not fucking the Kardashian, sweetheart. I ain't about that life. It's not because I don't got fucking bread for that, but... So basically what they did was they obviously removed some cartilage in here, took it out, and obviously, I don't know, probably threw that shit in the garbage. They didn't sell that on eBay. What are they gonna say? Fucking selling Crew Aesthetics is fucking cartilage for 200 bucks? So yeah, they took out some cartilage, and that was the only way that it could actually help benefit me from my nose not closing in as easily. Now, if I do this, yeah, looking basically like Caesar from Planet of the Apes. We all know I look like it. Everybody's been hiding it for a while, but let's be honest here. You guys can just spam in the comment section, Caesar from Planet of the fucking Apes. Because I know, I look like him. I'm probably the brother of him. We don't know what's going on there, but you don't gotta lie. I know, I get it. Every girl's told me that shit. Motherfucker. So yeah, it's helped a little bit, you know, in terms of that. So if I, you know, push up my upper lip and going like this, you know, it obviously helps, and like, you may even say, oh, it's still closing in a little bit, but guys, when I'm telling you, my nose literally closed, it would close all the way like I was holding it with two of my fingers. It was insane. I was like, what the fuck is going on? So yeah, not only was my septum deviated severely, especially on the left side, but that issue also occurred. So even if hypothetically speaking, I was capable of breathing through my nose, you know, just normally, I wouldn't be able to breathe through my nose normally because my nose would just collapse and close in on itself. So I wouldn't get any airway to begin with. So there was so many fucking problems that I was having. No airway, you know, nose closing in on itself. What am I gonna do? Kevin, what are you gonna fucking do? So I got the surgery. I got the septoplasty done, and it was a pain in the ass, I'm not gonna lie. I'll pop up pictures right here, right here, right here. I'll show you everything. I do not look like the sexiest guy in the street, but I started recovering. Now, it was a pain in the ass in the beginning. I'll explain the, recovery process right here, right now. But it was just a pain in the ass. The first day, I just wanted to jump off a cliff. I did not really feel too happy about this. I was actually starting to regret the surgery in the beginning because of the fact that now everybody is it just varies, okay? It varies on the pain levels. Some people actually have a higher pain tolerance than others. Some, actually don't really feel too much. Or like, it's just uncomfortable. It is what it is. But I actually felt a fuck ton of pain. I was like, oh my God. Literally, the doctor was like, some people say, it's painful. Some people are like, it's whatever. It just varies on person to person. And I'm over here thinking I'm going to be that person who's like, yeah, it's whatever. But that whatever was holy fucking shit, it hurts. Not that it hurt too much. It was just the uncomfortableness was so uncomfortable that uncomfortableness became pain. Does that make any sense? So the first day was very annoying. Now, note that when you get this surgery in particular, your nose is gonna constantly be bleeding every single day. You're gonna have blood coming out of your nose, mucus, draining. You're gonna be like, am I a water fountain through my nose of blood and mucus? Like literally, it's like that. It's like, what the fuck is going on? It's unfortunately gonna happen to you. You're gonna be bleeding a lot, and I think the hassle with that is when you start sleeping and then the blood starts dripping, you're gonna have to buy something that's gonna be holding up against your nose. Probably like something that I had in my last video that I made about this. Something like that, and honestly, that'll help you a lot. And the only thing about it though is it sucks, because when you wake up, all that blood and mucus is gonna be overlapping and a slight bit, and when you take it out, it's just gonna be a string, like it's fucking string cheese. Not the most attractive thing. Second day, still very painful. Now, no, the first day I didn't sleep whatsoever. I slept like an hour or two. Not just, wow, okay. Well, nice. I'm not gonna sleep. I'm going to, I'm losing my mind. Okay, nice. I actually started watching Netflix and watching movies and shows. I never do that. I never fucking watch movies or shows. That's not my thing. And so if I did that, there's a serious problem. Second day, very painful still. I mean, it was, to even say that it was a little bit less is just, I don't even know. It was not. It was still painful. Third day, it started getting a slight bit better, and it sucked ass because of the fact that I literally had to edit a video to post on YouTube the next day because of the fact that I had one video pre-saved already before I had the surgery, thinking, okay, I'm having surgery, I'm gonna make a video before I have this surgery, so I have something as backup because obviously I'm not gonna be physically, comfortable talking on camera. I'm actually gonna be incapable of talking on camera or doing anything along those lines, interviewing girls, working out, doing whatever I usually do on my channel. So I'm like, I'm just gonna have a backup. Little did I know that backup was not enough, man. Little did I fucking know. Fourth day, I was like, I'm feeling a little bit better. Now, note, guys, you have splints in your nose. They're basically like this long. Inside your nose, just up against like this to basically... the best way I could put it is they're basically the cast of the broken arm. I've said that in my last video, actually, now that I remember. So yeah, it's basically the cast of the broken arm. Now, guys, they take this out about 5 to 7 days later. I took it out my 5th day. And basically, the reason why they put these is to basically hold everything together, make sure nothing moves, and everything's in place because your, nose is very sensitive and fragile at the time because you just fucking basically fucked your nose over. In surgery, your body's like, what the fuck is going on? I just had surgery? What is this shit, dude? Like... your body doesn't know what surgery is, so your body's like out of whack, and so everything's just to hold everything in place and, all of those things. Fast forwarding to the 5th day. I was not a happy camper. I'm not gonna lie. I was not a happy camper. It was probably the worst / best day out of the 5 days I already had with, after the surgery. And here's why. When I had the splints removed, guys, I had stitches right here somewhere, and then there's like removable stitches in the inside, and then the splints, right? Taking out the stitches in the beginning was like a little bit painful, but dude, oh my fucking God. Taking out the splints was so uncomfortable. I swear, I thought an alien came out of my nose on both sides. I was making noises. I sounded like I was nutting in like 10 different ways. I was like, I was like, oh, fuck, dude. And I had to keep my head still. That was the worst part about it. I had to literally go back like this and then keep my head still. I could not move. I could not jerk in any sort of way because I'd probably fuck myself up if I did that while they're taking the fucking splints out. So I had to stay still. They took it out. After they took it out, then the doctor was like, all right, now you can breathe through your nose. And so I went, and in my head, I'm like, is this how it feels to be fucking human? After that, it's actually funny because he was saying how I could actually start breathing through my nose now and, all of that, but I didn't want to. Like, it was a weird feeling. Like, I didn't feel comfortable doing it because of the fact that Although I was breathing through my nose, it felt very tender and like, this sounds disgusting, but I literally could smell the insides of my nose in a way. It was very weird. It felt, I don't know what smell this would smell like, but imagine knowing the smell of like raw tenderness inside like your flesh. I just smelled flesh. It was fucking weird. I don't know. Maybe I'm hallucinating. Maybe I took something. I don't fucking know, but it was very weird. Later, a couple hours after that, my nose started getting very congested once again, and that was normal. That was going to actually happen. And then it started, getting congested and started draining a lot more again for a couple of days. But then after, I'm not too sure, I think it was my 10th day or 11th day, no more drainage. I felt very happy about this because then I was like, yes! I can finally make videos without having to worry about the drainage. Oh my God, somebody is on my side because I am fucking happy right now. I could not make any facial reaction. I couldn't smile. I couldn't, Even when I still do that, my nose feels a little weird, but nothing compared to before. I could not do that because if I smiled, obviously your face does a whole chain reaction and like that whole nose moves and like everything starts, moving around. And so it felt uncomfortable. It felt like I was stretching something that did not want to be stretched at the time. So now there was one thing that I did not expect from this surgery though. And I'm not going to lie, it was pretty uncomfortable. So I'd say about 2 weeks ago, which would be 2 weeks after my surgery, 2.5 weeks. Let's lay it out that. After like 2.5 weeks of my surgery, your nose starts building these crusts, right? They're basically, I don't know, for example, let's say I cut myself right here, just a small little cut. Your body, obviously the skin, you get a scab. Imagine those scabs are inside the nostrils, right? They're inside the nose. So I had these crusts. And it is not fun because you actually swallow those crusts. Heaven, why is that so bad? You swallow it and you call it a day. Well, one day I was laying in my bed, taking it for what it is and just relaxing. I'm vibing over here. I'm watching some YouTube videos. If I'm not making videos, I'm watching them. So I'm watching some videos and I'm literally like, what the fuck is going on? Am I coming down with something? So when you get a sore throat or like strep throat and it slowly starts developing the symptoms as the days go on? No, this was not like that. It felt like more instead of days or hours apart of, getting like that dryness or the scratchiness or like, oh my God, like the coughing or whatever. It really fast paced itself into more like minutes to then seconds. I'm like, oh my God, it's getting worse, scratchier, drier. Like, I was like, what the fuck is going on? I was like, dude, I'm losing my shit right now. It was to the point to where I got up out of the bed and I was like, oh my God, I'm drinking water and it's still very dry and very scratchy. It didn't help whatsoever. And then all of a sudden I swallowed something like, it felt, I don't know how much it was. It was probably very small, but it felt about this big, just gulped down my throat. And I'm like, oh my God, what the fuck was that? I mean, like, that shit hurt, kind of. It didn't hurt, but it was just very uncomfortable. As soon as I swallowed whatever that was, which at the time now I know it was crust, I was like, dude, that shit went away completely. Like, no scratchiness, all the dryness went away. I'm like, the fuck was that? That was the weirdest thing I've ever experienced in my life. Then, a couple hours later, it happened again. I'm like, oh my God, here we go again, round 2. I already know what the fuck is gonna happen. And it actually started hurting this time. Like, when I would swallow, like, it would hurt. Like, I was like, oh my God, dude, do I have to go to the hospital? What the fuck is going on? Is my neck enlarging? Like, is something in there that's gonna fucking explode? Like, what's going on, dude? So then I'm swallowing and, because I'm like, all right, I'm expecting something to go down to where this pain just immediately goes away once again. And so I do it. And then an even bigger one just goes down. I'm like, Jesus fuck, dude, what was that? 2 days later, I went to the doctor and then he told me that basically your body, after the surgery builds these like crusts and it's a part of the healing process. And obviously the way it gets rid of itself is to just going back and just going down the throat, right? So you just swallow it, at the end of the day. Now, he says that sometimes he, could take them out and shit, but at that point in time, it was not even necessary for them to take out anything on my nose because of the fact that most of the crust was already gone down. And then on top of that, I had like maybe 2 little crusts on each side, but very small and just, it was gonna eventually go away. So maybe some of you guys are watching this video like, this guy with the fucking Tom and Jerry t-shirt, he looks like a piece of shit wearing 2 daggered earrings that everybody judges him for in the comment section. Every other comment, I mean, it doesn't get old. I mean, fuck, dude, it can't get better than that, right? This guy, he looks like a piece of shit. He looks homeless because look at his hair. I laid this video out and made it and edited it and actually posted it on YouTube because of the fact that I actually think it has valuable resources that some people can actually take in for themselves and say, wow, you know what? thank you for telling me that, because you know what, now I feel a little bit more motivated getting the surgery, so thank you. I'll let you know how it feels. So yeah, I mean, that's just the story of what it is. And you know, some people actually wanted me to do an update about my surgery, so I actually was not too sure, because you know, when I made that video in particular, I mean, dude, I feel 100 times better compared to then. Like, I was actually forcing myself to make that video. It did not feel good at all. Like, I couldn't make no facial expression. I couldn't laugh. I couldn't scream. Because, you know, screaming, you stretch out your mouth. Again, the whole chain reaction with your nose stretching, all that. So, it sucked a lot for me. But now I'm back to everything. You know, I'm back to fucking everything. So, with that being said, I hope this, you know, helps some people. Take it for what it is. If you guys enjoyed this video, make sure to leave a like, comment, subscribe, hit the notification bell if you haven't already. Once again, it's your boy Kevin Diaz from Crew Aesthetics. I just swallowed a fucking spit. Once again, it's your boy Kevin Diaz from Crew Aesthetics, and we're fucking out. Peace. Boom.